Hello, everyone, and welcome back to MS Can Be 2021 Virtual Edition. My name is Dalia Nasser, and I am a part of the event committee here. So I was diagnosed with MS in April of 2018, and since then, it's kind of been full steam ahead with the MS Society, both as a volunteer and a fundraiser. So I'm very happy to be a part of this year's event. So when planning this event, we considered lots of different topics that are relevant to us young adults affected by MS. And we ultimately landed on 3 and pulled together some speakers to help us be more empowered in the areas of employment, personal finance, and healthcare. I remember when I was first diagnosed thinking about, should I disclose this to my employer or not? What if something happens and I have a relapse and then they don't know that I have MS, and will it kind of seem fishy to them if I'm all of a sudden out for a couple of weeks? So I know that many of you are probably working and probably also have the same questions about navigating MS in the workplace. And with that, I'm very excited to introduce Dr. Monique Gignac, who will talk about the evidence and what the evidence in this area tells us about talking to your employer and what you need to think about in terms of accommodations and support in your work environment. Now, if you have a question for Dr. Gignac, she will be available to answer some questions after her presentation. Please type any questions that you have into the Q&A box on your right. And just please keep in mind to ask those questions that are general in nature and that might pertain to the crowd as a whole. But before I welcome Dr. Gignac, just let me tell you a little bit about her. So she is the scientific co-director and a senior scientist at the Institute for Work and Health and a professor at the Dalla Lana School of Public Health at the University of Toronto. Her research examines psychosocial factors like stress, coping, and adaptation, and their importance in understanding the impact of chronic conditions on the lives of adults. Of particular interest is her research on workplace communication, privacy, support, and the accommodation needs amongst individuals living with chronic episodic conditions. So without further ado, let's please welcome Dr. Gignac.
Good afternoon, everyone. Thank you for the opportunity to let me speak with you a little bit today about working with an episodic disability. What I thought I would do for my presentation is divide it into roughly 3 parts and address issues around what research tells us about whether I should tell my employer I have MS, support and accommodation needs at work, and what matters to employers when they're providing support to workers with MS and other chronic conditions. Just to start us off, I want to make it very clear that when we talk about a disability, we don't mean that a disability is a character trait or a state of being. This is really something that results from the interaction between a health condition and personal and environmental factors. And that can include negative attitudes, public policies and practices, physical environments, and limited social support. More and more, we're hearing people talk about episodic or dynamic disabilities. And what they mean are situations or conditions where people may have times of relatively good health, where they have no activity limitations, and times when one's health could interfere more with activities. And so disability can become intermittent, or there can be environments where there are few barriers. And so people can be, have, again, no disability, and other environments where there are more disabilities. Very often, not always, these situations are unpredictable. So a person who's doing everything they should to take good care of their health may still find that they have situations where they are faced with activity limitations. And often others aren't aware of it. They aren't aware of changes in health. They don't know what may be impacting a person's life. And so we think sometimes of disability as being invisible. Statistics Canada has been talking more about dynamic disabilities, and they also emphasize these notions of recurrent disability, where a person may have relatively long periods of time with no impact at all. Sometimes progressive disability, where again, a person may have periods of good health, but over time, a condition may be getting worse. And then fluctuating disability, where there may be very short periods of time with lots of changes in them. What this means for people who are living with MS is that there can be challenges at work in thinking about whether or not to communicate health needs and protect one's own privacy, and in terms of getting support and accommodations, while at the same time trying to maintain high levels of job productivity. So if we turn to this first question, should I tell my employer about MS and that it can make some job activities difficult? I wish there was a simple answer to that question, but we're seeing from the research that it's quite complex. The first thing I think people should do is learn a little bit about your rights and obligations. So in Canada, there are privacy protections for personal health information. An employer, though, can request verification from a physician that a health condition does exist and is creating some job-related activity limitations. But you can often, or the letter can discuss these challenges without actually disclosing MS or its symptoms. So a letter can focus on the fact that, yes, I'm verifying there's a condition, and it can focus instead on job demands and what the limitations might be. And I'll come back to that because that's sometimes difficult for people to know how to speak about. You will also need to disclose some information if your own or another's health or safety is at risk at work. So for example, if you were taking medication that makes you drowsy and you are operating equipment, you would have to let somebody know about this so that you're not creating this health and safety risk. I've provided links here to a number of different websites. They aren't everything that exists. You'll notice there's not everything from every province. Some provinces are actually in the process of changing some of their legislation or adding to it, enhancing it. But this is, you'll get all these slides later. So this is a start if you're looking for more information. But I think it's really important to understand that in thinking about whether or not you should say something to an employer, you really have multiple decisions to make. Whether you're going to say something at all, and whether this is a voluntary or others are asking you about your health and you feel it's more of a forced disclosure. You have decisions to make about when to say something, if you want to do something in advance or wait till there's more of a crisis, with whom you're going to speak, what to say and how much, and often people share sort of only what they need, so it's more of a partial disclosure. And what your goals are. Are you trying to build trust? Are you wanting support? Are you trying to avoid problems? And I'll talk a bit more about goals in a moment. Disclosure decisions also tend to be ongoing. They're not one-time events. Your health can change, your needs can change, your job can change, the people you work with can change. So people usually tell us that they find themselves in a situation where they're considering whether or not to say something on multiple occasions. And previous research highlights that often people have a range of goals for disclosing or not disclosing. So do these goals matter? Let me just tell you a little bit more about how we think about goals in research. Typically, we think about two types of goals. And this is not just for disclosing, this is for a lot of things that we do in our life. We often have approach goals. So we're trying to pursue something rewarding or a desired end state. I want to improve my relationships with others. So I'd like to get support at work. We sometimes can also have avoidance goals. So I want to avoid a punishment or an undesired end state, like being fired for poor performance. When we've done research with people with a range of conditions, including MS, these are some examples of approach and avoidance goals for sharing. So I shared information with people because I felt my job was secure and it was safe. I wanted to make changes and get support. It's not a big deal. It's just part of who I am. Those are some approach goals. Avoidance goals, well, I felt I had to say something to explain my work absences, so I didn't want to get in trouble. My health or disability was getting worse. I needed to say something. Others were noticing changes and asked if there was a problem, so I had to explain. So those are avoidance goals. Same kind of thing can happen even if a person's not saying anything. So I decided not to say anything because I can manage at work without others knowing, or my health or disability doesn't affect my ability to do my job. So these are basically people are trying to maintain a positive status quo. Avoidance goals, I didn't say anything because I was concerned about lost opportunities or my past experiences made me concerned. Nothing can be done, so why discuss? So when we look at studies that have examined disclosure, in 4 Canadian studies, we found about a quarter to a half of people had not shared any information about their physical or mental health disability with their supervisor. Again, these are studies with a wide range of different conditions. We don't have a lot of research about MS, unfortunately. Decisions whether to share tended to be, again, ongoing and complex. Even if somebody didn't want to say anything, they went through a lot of thinking and processes. Research has focused a lot on need and support as being really key to decision making, and that's not surprising. Those who have greater activity limitations or more symptoms, so in other words, more need, are more likely to disclose some information at work. And those who report their workplace as supportive are more likely to share information. When we asked people about those approach and avoidance reasons for their decisions, we found people tended to have not just one, but multiple, and sometimes they had both approach and avoidance reasons. There was no single right decision. So people who had shared told us about positive and negative experiences as a result of sharing, and so had people who hadn't shared. They also had times when people misunderstood and negative outcomes, as well as sometimes that worked out well for them. We did tend to find that the more avoidance goals you had, trying to avoid a punishment or a negative end state, tended to be associated with more negative outcomes. And that, I think, is because people are picking up on something about their environment. And so they are worried for a reason. They're concerned for a reason. And so that's why often we see more negative outcomes there. But we also find that people tend to delay sharing until there's a crisis sometimes, or a problem. And that's understandable, to not, hi, my name is, and here's my whole life story. So people may not want to share everything up front. But adopting some strategies to manage a condition more proactively without waiting for a crisis was also associated with better outcomes. And what that usually looked like was people taking advantage of existing policies and practices in their workplace. So people told us, yes, I have flex time, I use it, even though I don't always need it. But the flexibility is helpful if they had work at home, or if they had an opportunity to have an ergonomic assessment of their workplace through their health and safety committee, and often the health and safety committee will do this for you, they would do it, and it made a difference. So in just sort of summing up some of the things to think about when you're making a decision that's right for you, ask yourself why you're thinking about sharing personal health information right now. Is there a change in your health or your work? Are people at risk? Are you not taking good care of yourself? Ask yourself what your goals are. What are you looking for? What matters to you? Are you someone who likes to keep information private and wants control? Or are you feeling uncomfortable that you're keeping secrets from others? What do we need to understand about you in making a decision? What do we need to consider about your job and your organization? Does your workplace have a lot of policies? Have they helped others in the past? You've got some experience here. Are you feeling that it's a supportive environment to work with your colleagues? And then again, think about this: when should you say something? The when, the who, the how, and so on. It's not easy. One of the things we're doing with our research is creating a new communication decision-making tool, and I'll come back to some of these tools in a couple of moments. I'd like to turn now to what you should think about in terms of support and accommodation needs at work. One of the things, I share this slide a lot with workplaces. I think sometimes people in human resources or disability management tend to think that they are the first stop for people living with MS or other chronic conditions. And what they sometimes aren't as aware of, that you'll be very much aware of, is how much people are doing on their own to manage their work, because work is such a priority, such a big source of identity and financial comfort in people's lives. So really, if you look at the bottom of the slide, what people do often starts at home and outside of work. People make a lot of changes to their lifestyle, their treatment, their medication to manage their condition, so it doesn't impact work. At work, people will typically begin by making a number of smaller changes to their work, how they organize activities, what they do in order to manage things and keep maintaining their productivity. If needed, people may seek some support from coworkers, a trusted coworker or a supervisor. Sometimes that's relatively informal. Sometimes it may be a more formal request of a supervisor. Again, as I mentioned earlier, people will use existing workplace policies and practices, and then if they need to, they'll ask for more formal accommodations. And so that's where things start to become a little bit more public. And then often people don't go to human resources or disability management or others unless something very formal is needed, or sometimes, unfortunately, when things haven't been working out. So if a supervisor hasn't been supportive or others. But certainly you can approach human resources and disability management folks for information, and they can provide you with a lot of that confidentially. As I mentioned, we've been developing some new tools. One of them, this is part of this Accommodating and Communicating About Episodic Disabilities partnership grant. One of the tools is the Job Demands and Accommodation Planning tool, the JDAP. And I mention it because earlier I said that you didn't need to talk about a specific condition in disclosing some information if you're looking for support. But that leaves a lot of people wondering, well, then how should I talk about my condition? How should I talk about what I need? So we've created a tool that is aimed at helping people with that, and we'll be doing more testing of the tool. We've done some already, but we'll be doing more in the fall, and I can tell you more about that in a couple of minutes. Basically, what we have is 24 different job demands that we ask people about. And if you look at the far left, I know this is a very busy slide, you'll see 4 different types of tasks. So the questions are divided into physical tasks, cognitive or thinking tasks, working with others, or working conditions. So for example, under cognitive or thinking, one of the questions asks about whether or not concentrating for long periods of time is an important part of your job. So if you look in the middle column here, everybody is asked, is this demand an important part of your job? If you say no, you move on to the next question. If you say yes, you're asked whether or not it's currently difficult for you, and whether or not that difficulty changes over time or tends to be fairly stable. After you answer the questions, you get a personalized report. So for example, of the 24 job demands, if I said that 12 of them were important to my job, and I was having difficulty right now with 5 of them, I would get a report that outlines that. And for the 5 that I'm having some difficulty with right now, I would be linked to a variety of support strategies and accommodations. And so in the final column, what you would get are some examples of things that you might be able to do outside of your job, on your own, adjustments you might be able to make it work without permission, and more formal accommodations that might be useful relative to this particular demand. So not everything may work for every job, but we've tried to really give a wide range of examples and make them very concrete. So this is the French version of the slide. So for example, if you said that physical endurance or stamina was important to your job and you were having difficulty, you'd see a range of different examples. If you hover over any one of them, it would open up into more concrete examples. And again, they might not all be something that you could do, but this is really to help you brainstorm. We also have a version for supervisors and managers to help them to be able to help others in addition to a version for workers. And you would get a different set of examples if you said that concentrating for long periods of time was difficult for you. There may be some overlap, but we've tried to make this very, very relevant to the specific job demands. So moving on now just to the final little bit I wanted to mention to you, what matters to employers when providing support to workers. We don't have a lot of information where people have spoken in research to employers. So we did a small qualitative study where we really did in-depth interviews with a range of individuals. We had 27 people in the studies, including disability managers, HR, supervisors, talked to union representatives, labor lawyers, a whole range of people. 5 of these individuals themselves were living with a chronic episodic condition. When we asked them about what their workplace looked like in terms of support, the conversations fell into these 3 buckets here that are represented by the 3 different colors. So there were conversations about the health condition and the process of support. There were conversations about what happens when someone tells you something, they communicate, that's the green box. And then what happens when someone decides not to say anything, but others notice a problem, and that's the gold box. I don't have time to go through all of the themes, but I've highlighted some of them in yellow because I think they may be a little bit interesting for you. And the entire article is available in an open access journal. So one of the themes that came up that was interesting to us was this misgivings about others in the workplace who are providing support. So workplaces told us that they have a lot of people in the workplace often who do provide support. And while they recognize everybody's necessary in this process, sometimes people had concerns about other skills or their training in providing support. In particular, there was recognition that there could be wide variability in supervisor skills. There were others who, I think everybody kind of came under fire a little bit. So sometimes people felt HR was there to represent the company and not the worker, and sometimes coworkers were a problem. But there was an acknowledgement that supervisors sometimes don't have the training. So what you need to know is that you should be prepared for variability in past experiences and workplace practices. You might be able to access support with very few individuals involved, and on an informal basis. There's certainly some wonderful supervisors and managers out there, but you may need to seek support from more than one individual if you aren't able to get what you need. Another theme that came up very strongly was about subjective perceptions. So workplaces told us that their organization was trying to build awareness and educate their workforce about negative stereotypes and preconceptions and biases, and that these do exist and they're trying to do something about it. But they also acknowledge that it's human nature to sometimes want more information to provide support. They recognize that privacy legislation is a good thing, and they respected it. But they wanted people to know that, it's not uncommon if I were to say to you, how are you? And you said, I'm not that great. It's natural for me to say, oh, what's wrong? And so sometimes they look like they're seeking more information when they know they really maybe shouldn't be. And there was also recognition that attitudes make a big difference in the support process. So what you should know is that requests for information are mostly asked out of a concern and a desire to help. Most people are not trying to be nosy, but you may need to tell them you would prefer to keep details of your health private. You don't have to share more than you're comfortable with. Also, of course, be aware that positive attitudes and believing support can be worked out make a difference. That's your positive attitude. That's the attitude of others as well. And of course, gossip and poor organizational culture are challenges in some workplace. So here's just a couple of quotes. When a business owner said to us, I can't tell you how terrible it feels not to know what it is, not because we're nosy people, but from a support perspective. So just underlining that we get this, that there's this tendency to want to know more and we shouldn't. And then there's some workers who they have a way about them, they explain themselves and you hear them. Then there's other workers that are just more aggressive or demanding. It doesn't mean that their issue has less merit, but people just sometimes start to shut those people down because they can't see past their personality and that there's a real issue here. And so there is this recognition. They try not to take into account the sort of attitudes, but it does sometimes play a role in providing support. In terms of not sharing information, the last two themes I'll just mention. One was this casting disability as a performance problem that sometimes happens. And what often unfolds here is in larger organizations, formal communication is triggered by meeting a threshold of absences. So if you've been away a certain number of days, a company may have what's called an attendance management or attendance support program. And suddenly you find yourself in a very formal meeting with your supervisor and HR to explain why you've been away so long. And workplaces and workers both say this really can pressure people into saying something when they weren't ready. It tends to recast now disability as a performance problem. So suddenly you're there trying not to get yourself fired, going through these progressive disciplinary kinds of processes instead of talking about support. It tends to also focus future discussions on these performance problems that you're having and not your skills and abilities, and can unfortunately erode trust and confidence, although they weren't intended to do that. So this is something, before you get to this point, you may want to think about saying something. Because finding yourself in this process can mean a very different road that you're taking than if you had maybe mentioned something, if you have needs and you're away a lot previously. And so this is, just a quote here. It sets up an urgency at the beginning because usually by the time they might involve a disability manager, they're quite high in the attendance management program. An employee in a lot of situations is not getting along all that well with management because they're being attendance managed. And the final theme, Very rarely, we heard that workers sometimes deny outright that there's a problem when they're confronted by a supervisor or HR. So people are seeing things, work is not getting done, there are maybe interpersonal problems. They're asked if there is something going on and they say there's no problem at all. These are really among the most challenging and prolonged and stressful situations. They are rare, tended to happen more when there were some mental health components. So for example, someone who may be moving into a depressive episode and isn't entirely aware that they are moving in that direction. So having some support outside of work to kind of alert you to, I'm noticing a change in you, in your behavior, is everything okay, is really helpful. So here's a quote: people themselves, they may not see it. It may be a slow progression. They start missing deadlines, showing up late for work, looking disheveled. If a person doesn't realize, they're just thinking, I'm having a bad day. But others are thinking this is a pattern of behavior. So I know that was a lot in 20 minutes. Let me just leave you with some take-home messages to summarize. Multiple sclerosis can cause episodic disability. Sometimes it's more constant, but very often it isn't. Challenges at work are often the result of workplace situations and settings that can be accommodated. The decision whether or not to share some information about one's health is complex and stressful, but there are things to consider that can help make the decision, or at least help you feel as though you've taken into account a number of things that are important to the decision. Workers with MS use a range of informal and formal strategies and supports. And one of the things that's important to do is to give people ideas, to brainstorm this, so you don't have to reinvent the wheel. Employers very much highlight not just what the demands are, but workplace relationships, attitudes, and challenges that they face in providing support if somebody is denying a problem. And of course, new tools can facilitate having a conversation and potential supports. And as I mentioned, that's what this Accommodating and Communicating About Episodic Disabilities grant is that we have right now. It's got a lot of researchers, and it also has various partners. The Multiple Sclerosis Society of Canada is one of the partners, and so we are working closely with them to try to develop and test the tools. We will be rolling out more testing on the JDEPT in the fall, and the communication tool probably in the new year. So if you are interested, please do let us know. I put a website at the bottom there. But now I will stop for your questions and any comments that you have about your experiences. Thank you very much.
Thanks so much, Dr. Gignac. Great and really relevant presentation that we just had. And I was thinking to myself while you were presenting that it's still relevant even in our virtual environment with MS having so many invisible symptoms such as cognitive delays and fatigue as well. So thank you. Okay, so now we're going to move on to some questions for you, and we have quite a few. And as mentioned before, you can just please keep them coming. We've got 50 more minutes about remaining, so feel free to pop them in the Q&A box. So first question we have for you is, for some people living with MS, especially younger folks or people who may have less visible symptoms, the word disability can be hard to label themselves or identify as because it may carry a lot of shame and stereotypes, etc. So do you have any advice about how to become more comfortable with this identifying term?
That's a good question. And I'll say something, first of all, that actually when we do research, we never use the term disability in any of our surveys. And because we know people often don't identify as someone who is living with a disability. So typically we will ask people about whether or not a health condition is creating difficulties for them in terms of performing certain activities. That seems to be something that people are more comfortable talking about, that they're having some difficulties, the difficulties come, they go. People don't like the term of disability because it tends to, again, going back to the beginning of the presentation, sort of label you as something that's an inherent trait. I think the more we can make people aware that when we talk about a term like disability, we're really talking about as much of a disabling environment or your negative attitudes or the lack of support creating the difficulties. And it's not just all about me. Hopefully that can start to educate others, unpack the term a little bit more. But I certainly wouldn't suggest that somebody feel that they have to use that term if that's not something they feel is important or to their identity or that they're comfortable with.
That's great. That makes a lot of sense. Thank you for that. So just another one. In the case of self-employment, so if somebody is contracting their services or running their own business, would you recommend that they discuss their medical issues to potential customers and stakeholders so that they're not losing business?
Yeah, that's a really tough question. And it reminds me of some of the work that's been done also on hiring. Should you say something when you're applying for a job? The HR people that we've talked to, often say, don't say things if you don't need to. And wait, so if you do have clients or customers of someone who's self-employed and you think there may be some delays, it might be something you need to say, but it certainly wouldn't be something I'd be saying necessarily if I didn't have to. Often people find a number of ways to kind of build in extra time they may need for getting work done if they're self-employed, or others who can take on some tasks if you have employees who work for you if you're self-employed. We spoke to someone recently who had his own business, and he talked very much about having this very integrated kind of network with it. It wasn't a large business, it was just 2 or 3 of them, but where he could say, it looks like I'm not having a great day, and someone else could step in. So it did mean extra work in making sure everybody was aware of everything, but it wasn't something that really impacted his clients, for example. He didn't share there very much.
Awesome. That's great to know, and something actually I've wondered myself. So that's a great question. Now, when we go about disclosing our medical diagnosis in the workplace, would you recommend doing it verbally with our managers or via a written email or something like that?
I think, again, it depends. You've got small organizations, you've got very large organizations. Some large organizations will want everything formally in writing. But if you have a fairly good relationship with people, if you feel comfortable having a conversation in person with someone, it can sometimes really foster that give and take and that kind of relationship building and trust that you want to maintain with someone, because you haven't gone to the sort of more formal route right away. And so I think if you have that good relationship, I would suggest that maybe you have a conversation first. But I also know that sometimes those conversations are very difficult to start, very stressful for people to have the conversation. So beginning maybe with a short email, I'd like to have a conversation with you. Here are some things that I would like to talk about. That might be helpful to kind of get things started, help someone like a supervisor or others prepare for that. And so that can also work. I don't think there's any evidence to suggest one or the other is better. We do have some people tell us that they have decided not to have the more formal conversation right away because they have sometimes some concerns that this might go into a permanent record. So if I send something in writing to HR and HR files it away, it might be there forever. And I'd prefer maybe to keep things a little bit more vague, even in an email, just like to talk to you to get some information and that kind of thing, to protect yourself. I don't want to suggest that workplaces immediately, jump on people and there are problems, but think about a few different things and your own comfort level.
Right, that makes sense. Now, you said something interesting about being concerned about it being filed away with HR. Could we look at it on the flip side as well, where that's maybe a good thing that there's some legal backing?
Absolutely. And we hear about that as well. And thank you for raising that, Dahlia, because there are times when it is important to establish a record so you can protect yourself. We do have duty to accommodate legislation in the country where where organizations are required to try to provide support and help to workers up to a point of undue hardship. Now, that point of undue hardship is the one that is sometimes hard to define. But by telling people that there are some difficulties that you're having, that it can be related to a health problem, you do establish a situation where you have some rights to support and accommodations. And as I mentioned in that last study where we had workers we had employers tell us that sometimes when somebody doesn't disclose, they find themselves in this performance management situation. They will tell us that, if you've had multiple opportunities to tell them that you actually have a health condition that creates some limitations or some disability or difficulties, and you didn't, and then suddenly you say you do, you can have people who don't believe you. You're throwing this out at the last minute to try to save your job, and in fact, you had lots of opportunities. So you're absolutely right. Having some record to get the support can be very helpful.
Great, that's awesome. Thank you for that. Now, could you please speak about disclosing before somebody gets hired?
That's a really tough area. We don't have good research on that. We have a number of things come into play. If you know you will need some supports or accommodations to begin your job, then it is probably wise to share some of that earlier, as opposed to not say anything at all, to be offered a job, to accept the job, and then say, oh, by the way, I can only work like this, I need this, I need that. Sometimes we hear from supervisors and HR that they feel that right away you started with a lack of trust. Now, should you say it sitting in an interview? Maybe not. You might want to wait to the point where it looks like you're being offered a job, and then perhaps say there are some things you should know. But if at the moment, in all good faith, everything is going really well, you don't think you need anything from this employer, you may not want to say too much at all. So it really varies, I think, based on the nature of the work and how you're, whether or not you're going to need something right away, and how you're feeling or managing right now, whether you feel that your treatment is controlling your condition. And also there are a lot of supports and accommodations that really are not overly onerous for a workplace. To have an ergonomic assessment in a good chair, to have access to facilities, a refrigerator for medication, or a break room to take some breaks. That's not usually too difficult for a lot of employers, and a lot of them have experience with these kinds of situations. And so you're not the first person usually to come to anybody a supervisor or HR and have special circumstances. And there are a whole bunch of things in people's lives related to their personal situation, having young kids, their preferences, their lifestyle. So work is very different now, and I think people should understand that.
Right, that makes good sense, and actually kind of makes me think of going on those first dates. You don't want to really tell everything right away.
And that's actually a very good point. It's sometimes we have heard from people that it makes them uncomfortable if people share too much of their personal life right away. Right. You may have been in places where that happens, and you're thinking, wow, I take the train a lot, and I've had people tell me their life story, and it's sometimes a little too much. So yes, think about how much and the when, but it's not the worst thing to hear about some aspects of a person's life and their needs.
That's right, and that makes good sense. Okay, next question. I have a concern about needs that are considered too high or specific to be accommodated. So how can you balance how much you share with not sharing or asking for something that may cause the workplace to suggest time off, new job, disability leave? For example, how can you know what is appropriate to ask for, or how to ask a physician to phrase something?
I don't know that I have good answers to all of that. I do think that, sort of taking a step back, for example, with something like MS, and being able to say, this is a condition. If you are saying something, if you need something, you probably should ask for something. So I think one of the first things we recommend is that you really think about, why am I thinking about disclosing now? Is something changing in my health? Is it getting worse? Is it likely to get worse? Is there something that will help me right now? It is true that if you need a complete change of jobs, if you simply can't do the work anymore, you may have to think about some bigger changes, and accommodations may not work for you. But I think that sometimes, step back and think, is this likely to change? Is this a period of time of 6 months, or, where I might need something? A lot of time employers are willing to discuss something even as large as a leave of absence. Depending on how long you've worked there, that may be paid, that may be partially paid or unpaid. But they, if you're someone who's been working there for a while, you're doing a good job, people really respect the skills that you bring. They can often work out things, and often we find HR has a lot of tools in their own toolbox to really try to help accommodate people, and are willing to do that. I'm sorry, I'm being very vague, but it's hard to know when I don't know sort of what kinds of the accommodations. Again, if it's sort of stripping your job responsibilities of things that you're expected to do. So if you are the person who is a receptionist at the front desk and you're saying you can't be there, you need to work from home. Obviously, that's going to be harder for somebody to accommodate than if you're somebody who has maybe a different job and remote working is more of a possibility, for example. It really varies by the nature of the work, and I'm happy to have people contact me and give me more specifics than you're able to give today, and see if there's anything I can recommend.
Awesome. Thank you for that. And actually, on that note, we do have a few more questions, but we are running out of time. So Dr. Gignac, you mentioned that people can contact you if they have further questions.
Yeah, I think we had a website. You'll have all the slides, and so there is a website there, and we do have a place for people to put in things, or my email. If you look up my name and look up the Institute for Work and Health, you will find an email to me there. So I really appreciate all of the questions that people are asking, and wish you good luck with this conference.
Thanks so much, and we appreciate your time. And yes, thanks to all the attendees that are engaging with all your great questions. As Dr. Gignac said, just please follow up with her after the session. And now we are going to break. So please come back at 3:45 Eastern time, where we're going to have a break with our wellness expert, Yana, who's going to be sharing some tips and tricks on sounder sleep. I think that's something that we could all kind of take advantage of. And don't forget to check out our Inspiration On Demand resource sections. If you have any resources at all that you'd like to add, just let us know, and we'd be happy to throw them up there as well. So thanks so much, everyone.
Thank you, Dahlia.
Thank you.